Lower blepharoplasty, muscle injury. I have 3 balls connected by sinew in the lower bag space, evident immediately after surgery. The balls, sinew, run from one corner of the eye to the other. With this is retraction and loss of elasticity of the lid. I am now 6 weeks post-surgery. Constant daily massage has not affected the size, placement of balls, although has somewhat helped the retraction. My surgeon has no idea what the balls are. I will see him again at 9 weeks. How do we fix this, as I now still have a bag caused by the balls?
Thank you for your question. You've submitted several very well taken photos describing your situation after undergoing eyelid surgery approximately 6 weeks prior. You stated in your question that you developed these 3 balls at the lower part of the eyelid that were present from the beginning of the surgery. In addition, you have described a situation of some eyelid retraction and laxity, and it appears that you're very concerned, of course, about the presence of these little balls at in the bottom of the lower eyelid, and that you've been doing constant massage, and again, they were present since the beginning of surgery, and you want to know what to do. You're intending to see your doctor again at the 9-week point. Well, I could certainly understand the reasons for your concern. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculoplastic and reconstructive surgeon. In fact, I've been in practice in Manhattan and Long Island for over 20 years, and revising complications related to cosmetic eyelid surgery is a significant part of my practice, and people come to us from all over the world for issues like yours. Now, I'm not saying necessarily that you need any revision surgery. I think that's a little bit early to tell. But there are certain elements of your procedure that I'm going to just help give you some idea of what my thought process would be for someone like yourself who would come to our office. So the presence of these discrete elevations, or we can refer to them as nodules, from the time of surgery makes one think of some basic issues with the process during the surgery and why those little areas form. Sometimes and I think they would all be basically under the same category of what we call fibrosis. Now, of course, at the time of surgery, you're not going to have what's called fibrosis, because that's something that happens with healing. But these areas can represent areas of fat that were just partially in those spaces. It could be areas of muscle. It could be areas of blood. There are definitely a few ideas that can go with this. The possibility of an infection is there, but it's generally unlikely. This is an area that is very vascular, and it tends not to get infected, but it's also something to consider. But I think that the question that comes to mind is, when I look at something like this, there's seeing it on the photo, and then on physical exam, I try to feel, is it soft? Is it rubbery? Is it hard? That helps a physician determine an option as to what to do for those areas. Now, there are options from this stage as well as moving forward. And in general, if there's a question about scarring or fibrosis, it is typical to inject low-dose steroid or anti-inflammatory into those areas to try to get them to soften. Massage is certainly an appropriate strategy and an observation to see how things turn out. For me, that's, of course, the major issue for you now, but it has also been an observation that with time and healing, a lot of times these little irregularities do improve. Now, the majority of people who I treat who would be in your age group, I do what's called a transconjunctival blepharoplasty. That means going from the inside of the eyelid to address the fat pocket. In your situation, you had what's called a transcutaneous blepharoplasty. So your surgeon decided to choose to do an external approach. With that external approach, what happens is you get something, what's developed to get to the fat pocket is called the skin muscle flap. And that skin muscle flap separates away from the supporting, the support of the eyelid, which the muscle contributes to. And when it's repositioned, sometimes the surgeon will trim extra skin. Typically, that's the reason why a surgeon will do it, because they'll want to reduce some skin with the perception that it'll tighten the lower eyelid. So that is contributing to the retraction and laxity of the eyelid. Now, the decision of doing revision surgery typically is deferred. In my practice, unless somebody has an issue where there is exposure of the eye or problems that are clearly significant enough to require early intervention, I generally do recommend conservative management. Conservative management such as what you're doing, which is to massage and to observe. As far as again, the nodules are concerned, the question of management still depends on examination. If they are present and persistent throughout your healing process, well, then some type of revision has to be done, because if it's not being or improving from conservative therapy, massage, and steroid injection. So I think that's the first line, and this is something to discuss with your operating surgeon. Ask about steroid injection. Ask if there's a clear explanation. Ask, what do they think? I know that your surgeon stated they don't know what it is. So if your surgeon doesn't know what it is, then it probably is advisable to meet with a fellowship-trained oculofacial or oculoplastic surgeon to at least get an additional opinion. You know, when people come to me for a second opinion, I never ever disparage the doctor who previously performed the surgery. In fact, I don't even ask. I just give my thoughts. Sometimes a physician can be so immersed in their procedure they may not think of possible other issues that they may not have recognized or are just not thinking. And so a fresh set of eyes can't hurt this situation. There are times where I've brought to light something that the patient was not aware of. Then I said, to speak to your doctor and say respectfully that you had a second opinion and that this was discussed, and what are your thoughts? And I think that a good physician will appreciate another doctor who is not undermining them, but is actually trying to do the best for their patient. So I think that that's something that is worthwhile for you considering, especially since your doctor said they don't have any idea what that is. So consider second opinion. Think about what these nodules may require in terms of intervention, such as steroid injection, which is probably likely to be the first line of treatment. And then, of course, be aware of the eyelid position moving forward. In our practice, we have patients who come from all over the world who have the single most common issue, which is lower eyelid retraction after lower eyelid blepharoplasty. And it typically requires a fair amount of revision work in order to get the eyelid to a better position. So monitoring this and just making comparisons before and after surgery with the eye shape, hopefully you will get closer to your original shape and you will ultimately be pleased with the final result. And that there is a likelihood of that if there isn't too much compromise in the eyelid structure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.